Good afternoon, everyone. My name is Jonas. I'm 18 years old, and I'm a young co-researcher on the REACH study in London. Today, my presentation is going to focus on how young people can look ahead in terms of their mental health and well-being post-COVID. And we're also going to focus on a festival that we hosted and that we presented to the community last year. But first, a brief introduction on who we are and what we do. REACH is a cohort study based in South London, and we work with over 4,000 young people in 12 schools across South London to examine what impacts and what influences young people's mental health, and particularly how lived experiences of social disadvantage and inequality affect young people's mental health. We are based in the Centre for Society of Mental Health at King's College London. My role, as you can see up there, is a young person's community champion. But what does that actually entail? We're a team of 5 young people aged 18 and 19, and our role includes influencing decision-making in the study, helping interpret data, but also reaching out to the community through podcasts and blogs that go on our website to help other young people in our community understand the work we do. Community engagement is essential to connect with the young people that we work with. So we intended for the festival that we hosted to re-establish the links that were slightly lost over the lockdown period. So more on this festival. This was co-produced by the YPCC team as well as the researchers on the REACH study. We held a festival for young people which brought young people together to discuss their mental health post-pandemic. It was the first in-person event that we held after the lockdown, and we believe it gave young people a space that is safe for them to discuss their own mental health. We also partnered with local community initiatives that delivered workshops and activities on topics such as how community relationships and interactions with the police affect mental health, as well as coping strategies. What we realized from this festival was that young people hadn't had it easy in the past 2 years. But young people are aware of the challenges they face to their mental health and are willing to talk about it if given a space. So, some more on our findings. Over the study during the pandemic, and with help from the contributions of other young people at the festival, we realized that it is young people who are most directly impacted by the restrictions that the pandemic placed upon us. Specifically, young people from backgrounds that are more disadvantaged, such as financially, young people who had difficult relationships with their families and struggled with homeschooling. We interpreted that young people from low-income households were more disproportionately affected by the pandemic, and the current cost of living crisis is only going to worsen this. So, from this, the YPCC, along with the team of researchers at REACH, created a 6-point plan of recommendations for policy on how we can help young people thrive. The first point, change the mental health narrative, which we describe as destigmatizing mental health so that young people can feel open to have these honest conversations around their mental health. Improve support and security for families on low incomes, which is a recommendation we focus more towards policymakers and local authorities. 3, ending the digital divide, which is a point that's really important to us, because a lot of the young people around us faced a lot of disadvantage when it came to homeschooling during the lockdown. A lot of the young people in the study didn't have access to multiple devices or any devices, so they felt that they were disadvantaged and they felt that they fell behind over the period of the lockdown. 4, increased funding for schools with a high proportion of pupils in low-income families. Schools are meant to be environments that advance opportunity, not that perpetuate the disadvantages that already exist in society. 5, provide more inclusive, safe, and free spaces for young people. Especially in London, we have seen a drastic decrease in the number of youth clubs and other safe spaces for young people to go to escape the more negative sides of their home lives and their school lives. So we really advocate for this recommendation in order to help young people thrive post-pandemic. And finally, improving community relationships and young people's trust in authorities, such as the police. So to finish off, with our closing remark, what's next for young people in supporting their well-being? Well, as you can see, young people do have opinions and can influence important decisions that support other young people. For example, our co-produced 6-point plan. Because, after all, who knows what's best for young people than other young people? And I'd like to implore you all to think and consider the roles that young people play in your organizations and make sure they are not just tokenistic, but they are valuable and young people have established roles for their insights. Thank you.